Good afternoon, friends. We'll be discussing antibiotics abuse. Or actually, what is antibiotics? They are families of drugs that are specific in treating bacterial infections. But unfortunately, many of us have decided to abuse these drugs with reckless abandon. As a result of the incessant abuse of these medications with reckless abandon, we now have a problem in our hands. We now have bacteria that are resistant to lots of antibiotics. You take samples to the lab, you do microscopic culture and sensitivity. 90% of the bacteria will be resistant to the common antibiotics in our environment. Not just that, you common treatments such as gastroenteritis, common ailment such as pneumonia, they no longer respond to common antibiotics that ought to have cured these diseases, because everybody now prescribed drugs, antibiotics. Whenever they now have symptoms, they just go to the chemist or pharmacist and buy antibiotics without even seeing a doctor. Now, the complications of you abusing antibiotics, they are grave in such a way that, one, your immunity will drop, you'll be prone to a lot of bacterial infections, because you have decided to kill the good bacteria both in your intestines and in your vagina. You kill these good bacteria. At the end of the day, you'll be prone to more serious and severe bacterial infections. It will result to a time whereby people who are admitted for some bacterial infections that ought to have spent just 5 days, but they will now spend up to 2-3 weeks, because the antibiotics that ought to have worked are no longer working. For example, it is so bad that even our farmers who are poultry farmers, even the cattle rearers, they decide to add the antibiotics to the feeds of these birds. They add antibiotics to the feed of this bird. They add antibiotics to their water. At the end of the day, they incessantly expose both the buyer, the consumer of these birds to antibiotics. At the end of the day, these bacteria that are common in our environment become resistant to bacteria. So you see that the infections that ought to have been treated with just amoxicillin will no longer work. You will now have to scale to the next level and more expensive with much more complications. Not just that, surgeries. You now do surgeries, even follow all protocols, clean theater, sterilize instruments. You now see that in little, you now have surgical site infections, and then you use the antibiotics that ought to have helped these infections will no longer work, because you have decided to abuse the common antibiotics. You have to scale to a more expensive, more powerful, more with antibiotic that has a greater side effects. Not just that, for example, people, especially the women, they run to chemists once they have any foul smelling vaginal discharge that is uncomfortable, that is not comfortable. Instead of them going to a gynecologist or they go to see a doctor, they go to the chemist who jab them with all sorts of antibiotics, At the end of the day, they kill the good bacteria in their system, and they come down with much more infections. For example, people who abuse antibiotics, especially the women folk, tend to come down with bacterial vaginosis, whereby they decide they will have foul, smelly vaginal discharge, especially during their period or during sex or after sex, that smells like fresh ice fish, very distasteful, and the female becomes uncomfortable. These are all one of the one of the side effects of antibiotics abuse. Another is people, for example, they even give their children antibiotics without doctor's prescription. Children come down with otitis media, for example, instead of them to go see a doctor that will examine the ear and know if it actually otitis media or otitis externa. It could even be a foreign body inside the ear that is even causing the discharge. They will become doctors of their own, go to the chemist who will give them all sorts of antibiotics. At the end of the day, the child will not get better. Simply go to see the doctor who will examine the ear with and see if there's either foreign body or whatsoever is causing it. Take sample to the lab, do microscopic control of sensitivity, and know which specific antibiotics that will be prescribed for this child. But instead of you to do that, you rather go to the chemist who will prescribe lots of antibiotics for you. At the end of the day, you even take them and it will not even work. And sometimes even the ear that is being infected may not even need oral antibiotics. Just drops of ear drops impregnated with antibiotics will suffice. We continue to abuse antibiotics. Another one is we have diarrhea. We decide to abuse Flagyl, especially. I would say Flagyl is the most abused antibiotics today. You have little diarrhea, Flagyl. You want to travel, Flagyl. Some of these diarrhea we even have, we don't even need antibiotics. Drink lots of water. Take ORS, and you'll be fine. Some of them are even caused by viruses. Some of them are even reactional. Maybe you ate something. It's not even bacteria, and you'll be fine. But some of us will decide to abuse antibiotics, and at the end of the day, it causes more problem for us. It causes more problem. You now go to the hospital, instead of you to spend 5 days, for example, someone have pneumonia or pyelonephritis, instead of him to spend some days in the hospital, the person will not even spend up to 3 weeks in the hospital, because the common antibiotics that ought to have been prescribed are no longer working. So they will scale up to more expensive antibiotics that require meticulous administration and observation. So this person will be kept in the hospital for up to 2 weeks, treating pyelonephritis, treating gastroenteritis, treating all sorts of bacterial infection that ought to, within 5 to 7 days, this person is discharged and will be placed on oral antibiotics. It's no longer so, because we have decided to pollute everywhere with unnecessary prescription of antibiotics. Let us desist from abuse of antibiotics. I think 2 years ago there was a publication whereby it was discovered that there is a super bug of gonorrhea that no longer responds to our common antibiotics. It's a disaster. Imagine someone having gonorrhea that ought to have responded to antibiotics within 5 to 7 days, no longer responds. You give this person the antibiotics, it no longer responds. The person needs to be admitted and need to get a very expensive antibiotics for a common gonorrhea. Why? Because abuse of antibiotics in our environment is becoming too much. Let us desist from it. Let us desist from abuse of antibiotics. Next time we're going to talk on abuse of other medications, but let us start with antibiotics first. Antibiotics will kill the good bacteria you have in your system. Antibiotics abuse will reduce your immunity. Antibiotics abuse will even destroy your liver, will destroy your kidneys. Antibiotics abuse will cause cardiac arrest for some, especially those people who have what we call long QT interval. Antibiotics They are too numerous to mention. The abuse of antibiotics especially. Let us desist from it. When you have any infection, run to your doctor. Don't be a doctor of yourself. When you have diarrhea, take lots of water. Replace your electrolytes and observe. If it requires antibiotics, then you see your doctor. He will prescribe the necessary antibiotics for you. Not doing poly medications. Some of you will take doxycycline, tetracycline, flagyl, even Septrin for diarrhea. So please let us try and abstain from abuse of antibiotics. Thank you so much and have a wonderful rest.